Having recovered from chronic, debilitating back pain, Amber, owner of Let It Heal, can feel your pain, and she can also offer some relief. This is Daily Web TV. The back pain stops today. I'm here at Let It Heal speaking with Amber, and we're talking about the Bowen technique. Amber, at some point in everybody's life, we all suffer from back pain. Why was it so important to you to practice and specialize in the Bowen technique?
I got into this as a client initially. I used to suffer from awful back pain after a work injury. So what I did was I went to every possible technique available and nothing was helping. I planned on getting surgery, and then once I tried the Bowen technique, it was the only thing that helped me. So now that I'm completely healthy, I decided to go and learn it. I mastered it, and now I get to help other people feel better too.
So you were going to go for surgery, and you didn't have to because you did the Bowen technique?
Exactly, yeah.
What is this Bowen technique that I'm hearing about?
It's a little different from other methods, where there's a lot of other methods out there that will just kind of make the pain go away for the short term. The Bowen gets to the root of the issue, and it actually taps into the nervous system through little points in the muscles that stimulate activity, and all of a sudden the body starts to resolve the problem on its own.
Is it a painful procedure to go through?
Not usually. There are certain treatments that are a little bit painful for some people, but we do try to back off if needed. It can be done quite gently with excellent results.
So help me visualize what you're going to do when I come in here to get the Bowen technique. I'm obviously going to be getting someone looking over my whole body, seeing what the problem is. And what do you mean by gentle hand movements?
It's just basically a rolling of the thumbs or of the fingertips. And we can do it through clothing. So we'd have the person laying on the massage table, dressed as comfortably as they can. And just basically I'll put my hands on their body and sink into the muscle and move the skin just slightly. And the muscle underneath will then be stretched, and it sends a message to the brain, which engages the healing process. And the clients feel anything from tingles to warmth to cool. Sometimes the intensity of the pain may increase temporarily while the nervous system is addressing things, but basically there's just this deep relaxation that's achieved, and most people fall asleep.
Nice. So it's not an invasive procedure?
No, it's nice because we can do it through clothing. We don't have to be too invasive, and it just basically feels good the whole time you're getting the treatment done, and it gets to the root of the problem.
What's the difference between back pain and sciatica?
There's a big difference. They can be connected. Some people have both, but back pain can be anywhere in your back, anywhere along the spine. It can wrap around into the front. Sciatica is specifically rooted in the sciatic nerve, which starts in your buttock and it runs all the way down to your toes, which means for people that have an irritation there, it can just be excruciating. It feels like someone's got a knife in your buttock and they're just turning on the voltage.
To that.
Yes.
When I was pregnant, I had to go on a leave because of the sciatic nerve, and again, there's that feeling going down my legs. So you're saying that if I did a technique, I could have relieved that pressure?
Pretty quickly, too. There's actually a procedure that is called the pregnancy technique, and it's just a couple of little tweaks, because pregnant people don't usually like to lay for too long.
No, because it's very uncomfortable.
Can't get very comfortable. So with pregnancy, there's a constant aggravation, so it might mean that you have to stop in, a few times rather than just the 3 to 5 treatments that most people need. But it certainly gets the mums and the dads the relief, because that means everyone gets to sleep at night.
I was just going to say the dads. Let's bring the dads into this. Is there something that they can do to help relieve the pressure from the sciatic pain that you would have when you're pregnant?
Yes.
In between?
Yeah. Oh,
sessions?
exactly. And I always involve the fathers if I can. It's such a quick, easy manipulation. As long as they are comfortable doing a couple of hand movements, then I just bring them into the treatment with me and I'll demonstrate so that they can relieve whatever pain, not just during the pregnancy, but during labor. If someone's having back labor, it's so nice for the father to be able to come in and do something instead of just sitting there feeling sorry for his wife, right? So
wish I knew this when I was pregnant.
Yeah, a lot of people do.
Where can somebody go to get started on feeling better?
Well, we can start with the website, which is www.letisheal.com. We've got 5 locations, one in Burlington, one in Dundas, Kitchener, Toronto, and St. Catharines. And all of the contact information is there. There's tons of reading there so that people can familiarize themselves with the technique and figure out what to expect. And of course, we've got certainly tons of staff that are happy to answer any questions.
Thank you very much.
You're welcome.
For more information on starting to ease your back pain, check out her website. I'm Tracy Bizot, and you've been watching Daily Web TV. What is one of a parent's main concerns? It's their child's health. Amber of Let It Heal Bowen Therapy Clinic is with us today to talk about how this simple, gentle technique provides relief from common childhood ailments. This is Daily Web TV. If you're a parent, listen up. We're here at Let It Heal, and we're going to be talking about the Bowen technique and children. Amber, how does the Bowen technique benefit children?
Well, aside from little injuries that creep up, like sprained ankles or growing pains, that's the typical stuff that people would think of for children. There's other issues that we can address with Bowen with a lot of success. For example, asthma is one of these things that you wouldn't think of as a back manipulation technique, but our success rate is absolutely great with children who suffer from asthma, as well as adults, but typically it is a childhood illness. So what we do is we do work on the muscles of the back and also the diaphragm, pressing underneath the ribs. If we need to, we'll work on the throat, but there's tips that we can also share with people so that they can sort of rule other things out. For example, pollutants that may be in the air that are aggravating the respiratory system of the child. We would definitely recommend getting rid of any cleaning products that would be airborne or air fresheners that are not all natural. Try to clean with lemon juice and vinegar and hydrogen peroxide, and don't be spraying things too much around asthmatics.
So we can use the Bowen technique to help prevent asthma?
Or prevent and just resolve the condition. You know, we've had kids coming in that are taking their puffer like 10, 15 times a day, and all of a sudden they don't need it anymore. And even for the nervous parents that aren't too sure, obviously no one wants to give up a puffer. Of course you would keep it there. But we do demonstrate a technique that they can do on their child in the case of an emergency that will just stop an asthma attack in its tracks.
Okay, what about colicky babies? How can you help me with a baby that's crying all night?
Yes, that's a lot of new parents' question, and it's one of these things that the doctor just throws up his hands and he just doesn't know. But with the Bowen technique, again, it's a resetting of the diaphragm. That poor child's muscle underneath the lungs on top of the digestive organs is not sitting properly. So nothing else can sit properly. As soon as we reset that basic diaphragm, and it's so gentle. I know parents are very nervous about having their newborns touched. It takes about 2 minutes. We don't even charge for it. It's so quick for us. And it just basically allows everything to slide into position, at which point the child will either let out a huge burp or the other way, or maybe a little bit of a spit up, and everything resets itself. And that baby can sleep, which means the parents can sleep, and the whole household gains.
Wow. So just a hand technique, you're going to relieve this baby of all the pressure of gas and stop them crying?
Yeah, and we can even do it while the baby's in mommy's arms if needed, right? So, although most moms are usually happy to pass the kid over at that stage in the game, but we watch them grow so quickly, and all of a sudden they're packing on the pounds and sleeping peacefully. You know, kids that didn't sleep for 45 minutes at a time, all of a sudden they go for 5-hour stretches.
Wow.
The moms are beside themselves. They don't know what to do with their time, but it's has an impact on the rest of that child's life because all of a sudden they got that important rest that they need when they're growing.
Wow. So we can deal with colicky newborns. What about a little bit older when we hit that stage where they're potty trained, but they have the bedwetting? Maybe it's something they've inherited. Can Bowen technique help with that?
It certainly can. It's one of the things on the top of our list that we see children for. It's unusual for people to talk about it openly, but there's far more children that bedwet than is common, than people know is common. It's a much higher percentage of children. And it's just we do the basic body work along their spine and legs and neck, and if more sessions are needed, we do a gentle manipulation on the tailbone that resets the basically all of the organs so that there's no prolapsing and everything's sitting properly, which means the bladder can get the signals sent straight, and all of a sudden that kid has dry nights and he's feeling better about himself too.
Where can parents go to get more information?
Best place to start would be our website, and all of the contact information is there for each of our locations. And when it's such a sensitive issue with a child, we usually recommend that the parents come in, give us a call or stop by, and then they can talk to us in person and we can answer any questions.
I'm sure there's lots of happy parents out there.
You better believe it.
Well, thank you very much, Amber.
Thank you.
For more information on Let It Heal, check out our website or drop in and say hi. I'm Tracy Bizot, and you've been watching Daily Web TV.